we didn't give attention to smoking.
Correct.
So can you just tell us what happens with smoking?
Smoking is probably the most terrible thing that is government approved in the world. See, drugs are very bad, but that is not approved. So at least there is some defense for that. And we have various defenses for this, saying, smoking is tax revenue. It is absolutely no brainer. It's a useless thing. It's a bad thing, and it's bad. Now it's bad in a million ways. And that alone will be 2 hours of discussion.
Yeah.
But simply speaking, for us as doctors, as vascular doctors, I have a problem is that with every cigarette you smoke, your vessel diameter drops by 1 in 4 times. That means it becomes 1/4 of it, of what it is now. Let's say if you have a 10 millimeter vessel, it becomes 2.5 millimeters. And this happens across the body. Technically, that is what gives you the little buzz in the brain, because the vessel is smaller. That kind of...
So when the vessel gets shrinks, so the
constricts, it gives you, the rate goes up and it gives you a little buzz, right? That's what makes you feel that you're concentrating more or studying better for the exam or something.
Correct.
But that plays havoc with that contracting, expanding, contracting. Let's say if you smoke 20 cigarettes, every time this will happen, every time it will go away. It's a big problem, right? It's unduly contracting. The second thing is free radicals. It produces enormous number of toxins. Free radicals, simply speaking, is a toxin that should not be there in your blood. And that can make your plaque rupture. So all of us, except if you are a very fit person, will have some degree of plaque formation. In fact, they say the plaque, which is the cholesterol deposition, happens from the second year of your life. In fact, the chubby baby, we say, is actually getting a little bit of cholesterol at that stage only, unfortunately, sadly speaking. So we all were chubby babies, maybe. I'm probably still continuing to be chubbies. So we do have some cholesterol, which will organize itself. That can get ruptured if this free radical, these toxins are going all over the place. So that's another problem. So that's why a lot of smokers will get sudden heart attacks and sudden leg attacks, or anything you speak.
One other thing that is related to your field is that smoking causes decreased blood supply everywhere. And one of the main thing is the reproductive system.
Correct.
And impotence is one of the things.
Yes. Impotence is very common in smoking. And impotence is very common in diabetics who smoke. And diabetes itself causes significant amount of impotence. So when you put them together, it's a perfect storm. It's like a storm, together. So that's something to remember.
Have you seen cases?
Oh, yeah. I mean, we do a lot of angioplasty for the pineal artery for the arterial cause of impotence. We do a lot. It's a small vessel and we do some balloon plasties. So we do get a lot of those patients. But very often, that cannot be fixed also. The smoking-induced impotence is actually fairly permanent. So a lot of hospitals that do Western African patients as medical tourism in India, they'll be doing at least 5 penile implants a day.
Wow.
Because the impotence is so bad. Because in Africa, you smoke a lot more.
Okay.
So there's a lot of Afro-American males who require penile implants. And they come to Delhi, for example. Delhi, there's huge penile implant centers actually.
Wow.
So that's all because of smoking. It's terrible for you.